Okay, so this is just going to be a read-through, not like the other ones that have been in this playlist. Okay, Introduction to Cognitive Neuroscience, Non-Declarative Memory. Non-declarative memory. In contrast to declarative memory, non-declarative memories are expressed through performance behavior rather than conscious recollection, and are not thought to be dependent on the MTL system. Okay, so non-declarative memories are not dependent on the MTL system, and again, the non-declarative memories could be priming, conditioning, or something like that. Three major forms of non-declarative memories are priming, skill learning, and conditioning. A typical priming study could involve having subjects read a word list for a made-up purpose and at another time, which may be on a different day, ask them to complete word stems with the first word that comes to mind. Even though subjects may not recollect the original word list, they're more likely to use these words other than other words they are not exposed to. Slide priming. Priming is defined as a change in processing of a stimulus due to previous encounter with the same or related stimulus in the absence of conscious awareness or recollection of the original encounter. Priming effects are immune to both brain damage, aging, and dementia. Since priming seems to occur automatically, priming can either enhance or impair performance, depending on the task context. So the main thing here is that priming occurs automatically. Explicit memory contamination of priming can be controlled with good cover stories, long intertest intervals, subliminal priming, rapid probe presentation rates, and other strategies. And so again, that's explicit memory contamination. So basically, like, you're trying to not have the subject be biased. Priming. A major distinction can be drawn between direct priming, where the prime and the target are identical, and indirect priming, or semantic priming. In direct priming, the test cue can either be perceptual or conceptual in nature. And so there's a little chart here with priming at the top, and then it branches into direct and indirect. And so let's tackle direct first. Direct branches off into perceptual and conceptual. Perceptual is something you can see, and so the prime might be something. And so the prime for all these are going to be envelope, but then the test cue for the perceptual one would be E blank, V blank, L blank, P blank. And so like you can perceive the vision of this and like put it in envelope, and then the target's going to be envelope. So prime, envelope, target, envelope, because they're the same, because it's direct. And so direct is like straight through, same prime and target. And conceptual priming, you see envelope, and the test cue is stationary, and then the target is envelope. So the prime and the target are still the same for conceptual priming, but the concept that relates them is implied because of the test cue. And so what's relating them is stationary. So again, conceptual priming would be prime with envelope, test cue, stationary, and then the response or the target is envelope. Again, remember the response is the target. Okay, and then indirect priming is semantic priming. It's just another word for it. So indirect priming is semantic priming. And again, semantic is just kind of like general facts, I suppose. And so the only difference for indirect priming and semantic priming is that semantic priming and indirect are the same, but indirect priming just means that the prime and the target are going to be related semantically, again with the semantic priming, but they're not going to be the same. And so you could prime with envelope and then give some test cue, but the response is going to be letter. And so envelope and letter are semantically related, seeing as it's semantic priming, but they're not the same thing. And so it's indirect. So the main thing is indirect priming, the prime and the response / target are not going to be the same. Okay, priming. Note that it is the nature of the test cue, not the target, that is semantically related to the prime. Note that it is the nature of the test cue, not the target, that is semantically related to the prime and target in conceptual priming. But it is the nature of the target that is semantically related to the prime in the semantic priming. Okay, so again, not the nature of the test cue, it's the nature of the test cue that is semantically related to the prime. Okay, that makes sense. The test cue is related to the prime semantically, and the target in conceptual priming, but in the nature of the target that is semantically related to prime is, okay, makes sense. Just what we said before. Okay, priming. Perceptual priming effects can last for months. Conceptual priming can persist for days, but semantic priming effects typically last for only a few seconds. So this makes sense because perceptual, it's like something you can grab onto. Like, you can literally see E blank, V blank, L. Like, are you not going to fill that with an envelope? Like, it's perceptual. It's literally right there. It's so obvious. Of course that would last for months. And then conceptual priming, it's still in the direct family, so it can persist for days, but then, like, the least powerful is going to be semantic priming because, like, the prime and the target / response aren't even the same in that one. Okay, so priming versus declarative memory. Perceptual priming can be disassociated from declarative memory on the basis of patient studies. Functional disassociations can also be seen as various experimental factors have different effects on recall versus priming measures. Really not sure what that means, but functional disassociations has something to do with perceptual priming. Okay, example, the level of encoding of primes matters greatly for recognition, declarative memory, but not for stem completion, perceptual priming. Okay, so they're saying that you need to have a more powerful you need to have a more powerful prime to get at recollections, whereas like familiarity can be weaker, which familiarity would be stem completion. Conversely, perceptual similarity between a prime and target item does not affect free recall, but matters greatly for fragment completion. Okay, so perceptual similarity between the target items. Okay, so perceptual similarity. So the cue and the target should be the same if you're trying to get a fragment completion, but the cue and the target don't have to be the same if it's just for free recall. Because for free recall, like you already have to have a strong enough memory for that. So if you are able to do free recall, you aren't going to need a particularly strong like perceptual stimuli to get you to do that. Okay. Perceptual priming can also be disassociated from declarative memory on the basis of its developmental time course. Okay, so this is throughout your life. While episodic memory performance improves early in life and declines in old age, perceptual priming effects are very stable across the lifespan. Okay, so perceptual priming, again, that's something you can grab onto, so it's going to last your whole life. And episodic memory improves early in life and declines in old age. That makes sense. Like, your grandma might forget what you talked about at lunch, but you're not going to forget if you're 20, but an 80-year-old grandma's going to forget like that one episode of lunch. Okay, so conceptual priming concerns priming due to prior exposures of conceptually related information, as observed in category association tests. Conceptual priming concerns priming due to prior exposure of conceptually related information, as observed in category association tests and general knowledge tests. Okay, so conceptual priming, you need to know general information for. Conceptual priming, you need to know general information for. That's all you need to know. Conceptual priming, you need to know general information for this. Conceptual priming, like episodic memory, is insensitive to perceptual manipulations, but it can be disassociated from episodic memory. First, conceptual priming can occur subliminally. Second, conceptual priming is preserved in amnesiac patients with MTL damage who have strong declarative memory deficits. Okay, And so that's strange because MTL patients, you would think that they would not have good conceptual priming because they wouldn't remember these concepts, but I guess the MTL patients still have general knowledge, and so this conceptual priming would still work for MTL patients. Okay, and now we're getting into repetition suppression. And so repetition suppression, which just means the second time around that I see a stimulus, the brain region is going to show a weaker response. It's going to be suppressed. And so repeated stimuli, but repetition won't always work. It's not always so straightforward. We'll get into it. It just depends on like the difficulty of the concept that you're trying to habituate. 1 second. Okay. Okay, so the neural correlates of priming are thought to be reflected in the phenomenon of repetition suppression. The activation evoked in sensory cortex by a repeated stimulus is reduced compared to that evoked by a new stimulus. In other words, the sensory neuron displays a memory for perceived encountered stimuli, and repeated processing of the same stimulus may be more efficient. However, repetition suppression effects do not always correlate with behavioral priming effects, and they're modulated by expectation. Okay, so repetition suppression is modulated by expectation. Good. And this is probably because you want to make the neurons more efficient, it says, and so it's repeated processing wants to become more efficient. Okay. Repetition suppression effects can be used to gauge which brain regions care about which types of stimulus characteristics. And so this just means like if you are imaging a brain and you see this initial area respond highly, and then you show it a second time, it responds a little less highly, and then a little less highly, and then show it again a little less highly. Like it's going to show that that brain region really does like care about that specific stimulus, and you can use that to kind of like generalize what brain regions are for what. And so generally perceptual priming is indeed associated more with repetition suppression and sensory cortex, and to a lesser degree in prefrontal cortex, whereas conceptual and semantic priming are primarily associated with RS in the frontal and temporal region. Okay, so all of these different primings are associated with repetition suppression, but perceptual priming, which is like where you see it, is associated mostly in the sensory cortex. That makes sense because you have to sense that prime. And it's not, the perceptual priming isn't very strong in the prefrontal cortex. That makes sense because that's mostly for processing. In order to recognize like some stimulus, you just need like perceptual, like you just need to be able to see and like to touch and stuff and to hear. Does that make sense? And then it says that conceptual and semantic priming are more associated with the frontal and temporal regions. So like the front and temporal regions, because those are kind of more for like processing, like those have cortexes in them, and so that's probably for more like abstract type stuff. And so that makes sense that conceptual and semantic priming, they're a little bit more abstract and less like, oh look, I see a boat, I'm gonna say the word boat now, which is kind of what perceptual priming is. Like it makes sense that the more abstract ones would be in the frontal and temporal regions more. Okay. And so the neural correlates of priming. In semantic priming, the prime and target differ but are semantically related. Example, after just having seen the word doctor, subjects are faster to respond to the word nurse than to an unrelated word like skateboard or something. And so this is called the spreading of activation. So spreading of activation, kind of like on objects, can also be for priming, along closely connected nodes in a semantic memory network. And so like these nodes are kind of like the different features in like the, remember when we were looking at how attention kind of spreads over like a whole object? Like this is kind of like this attention, spreading of activation. It's activation, not attention, but it's spreading over an entire node of a semantic memory network. Okay, and in support of this view, semantic priming is associated with repetition suppression effects in brain regions which are known to be involved in the storage of semantic knowledge. Okay, and so that makes sense. Semantic priming has a repetition effect, repetition suppression effect with the brain regions that are known to store semantics. That makes sense. Semantic priming, if it's going to be subjected to repetition suppression, it's going to be probably in the areas that have to do with semantic knowledge, and that specifically is the left anterior temporal cortex. Okay, and so left anterior, so that would be the left front. So just think of it as like the left front time on the clock, and so that would be what, like 9 o'clock? Left front time on the clock, yeah. 9 o'clock. And so semantic priming, which is like general knowledge, and you can think of it as 9 o'clock on the clock because that's when I study and gain kind of semantic, like fact-based knowledge. All right, so now we're moving on into a new section, which is non-declarative memories, parentheses, skill learning. So this is all going to be about skills. In contrast to priming, which occurs after single exposure to a stimulus, skill learning is a slow process that requires extensive practice. Like priming, skill learning is not dependent on the MTL. Okay, so skill learning does not need the MTL. That makes sense because the hippocampus is, it has to do with like relations and coding and stuff like that. And so, yeah, the skill learning would probably not have to do with that. Unlike priming, it does involve the basal ganglia and the cerebellum. That makes sense because basal ganglia is like more for movement, and cerebellum is like a mini brain. Okay, so skill learning is mostly in the basal ganglia and cerebellum. Good to know. Skill learning, basal ganglia, cerebellum. Skill learning, basal ganglia, cerebellum. Skill learning, basal ganglia, cerebellum. Okay. And we can remember this because like if you have Parkinson's and it's affecting your basal ganglia, you're still gonna have like all the memory related to like what skills you have. And actually no, the reverse, because if you have Parkinson's, you're not gonna be able to walk, so you're not gonna be able to do skills, and so like that's important. So yeah, that means the basal ganglia is important for skill learning. So just think of Parkinson's and skill learning and basal ganglia all connected. And also we can remember cerebellum is good for skill learning because think of Cinderella and she has a good skill in like cleaning houses, I guess. So basal ganglia, cerebellum are in skill learning, and of course cortical areas because the cortex is kind of in everything. While most skill learning involves perceptual, motor, and cognitive components, the experimental literature typically distinguishes between tasks that focus mostly on either one of the components. Okay, so either like thinking about something like analyzing an X-ray or doing a back handspring. That's like physical versus mental. A widely used probe of motor learning skills is the serial reaction time test, which is SRTT. So CERT. That kind of sounds like an army way to say sir, which you have to do like the really fast motor, like what do you call it? Like salute. So that makes sense. Like CERT. That's the serial reaction time test, and that tests motor function. Subjects push buttons in response to visual cues that, unbeknownst to the subjects, have a sequential structure. Subjects implicitly learn the sequence, as seen in the spread of SRTT performances in learned versus random sequences. This type of learning is preserved in MTL. Okay, so again, skill learning is in the MTL. It's preserved in MTL. Or no, skill learning is not in MTL. It's mostly in basal ganglia, cerebellum, and of course the cortex. Okay, And the reason that you know it's not in the MTL is because HM was still good at skill learning over time, even if he didn't remember it, because he could do that mirror drawing pretty well. Okay, but it's impaired in patients with damage to the basal ganglia. Example in Parkinson's disease. There you go. And so if you have Parkinson's disease, you're not going to be able to do as much skill learning. Okay, so fMRI studies have shown motor skill learning to be associated with the basal ganglia, the supplementary motor area. fMRI studies have shown motor skill learning to be associated with the basal ganglia, the supplementary motor area, the parietal cortex, and the cerebellum. Okay, so the only thing that we're adding here is the parietal cortex, and we can think of that because it sounds like parrot, and parrots have like a skill in repeating people. Okay. Okay, so perceptual skill learning refers to long-lasting improvements in recognizing and categorizing perceptual stimuli after repeated exposure, for example, reading x-rays. Perceptual learning appears to involve both low-level changes in stimulus processing as well as changes in high-level processing. Okay, so perceptual learning is going to be low-level changes in like each neuron processing and also high-level processes, such as new category formation. Okay, so that's a high-level process. And differential weighing of bottom-up information by decision-making regions in parietal and frontal cortexes. Okay, so again, the front of the parrot is making decisions. Skill learning, perceptual skill learning. Example, subjects are trained at fine visual discrimination tasks. Example, subtle motion detection. Both neurons in the sensory cortex associated with the relevant stimulus characteristics, as well as the regions that read out this activity to form a perceptual decision, can be subject to plastid changes. Okay, so like in and out are both plastic. Okay, so cognitive skill learning is evident in tasks where categorization is difficult due to informational demands. Okay, cognitive skill learning is evident in tasks where categorization is difficult due to informational demands. Okay, so you need, so this is like the weather example. So there's an informational demand with the weather example. Rather than perceptual or motor demands. Example, in the weather prediction task, subjects slowly learn to guess the weather based on a bunch of variables. Okay. Parkinson's patients with basal ganglia damage do not acquire this type of skill, whereas amnesiacs do. The opposite pattern of performance deficit can, of course, be observed in declarative memory tasks, such as episodic recall. Okay, so reverse. Yeah, so Parkinson's will be good at episodic recall. They have all their memory intact. Okay, so finally, we're going to get into conditioning. So conditioning, there is classical conditioning, the repeated pairing of an unrelated stimulus to something that normally triggers a reflex response. So maybe like pairing a strawberry to pain. Okay, and then that leads to a conditioned response to the presentation of the conditioned stimulus. Okay, so the conditioned response is fear. Presentation of the conditioned stimulus is something you need to input. So the conditioned stimulus is like, all right, well, so we'll think of tying fear to a conditioner bottle, and so then the conditioned stimulus would be the conditioner bottle, and so you're tying the fear to the conditioner bottle, which is the conditional stimulus. Operant conditioning is the altered probability of a behavioral response when that response is associated with reward or punishment. Okay, so operant conditioning, you're more likely to press the lever if you get candy afterwards. Both types of conditioning involve an acquisition phase, various trials, and are subject to extinction. So both of them you have to do multiple times, but they can go away in the absence of unconditioned stimulus or reinforcement. Okay, so the conditioned stimulus is the conditioner bottle. Unconditioned stimulus is the pain, because you always react badly to pain. So if you stop giving the pain, then they'll stop reacting badly to the conditioner bottle. In classical conditioning protocols, one can distinguish between delay conditioning and trace conditioning protocols. In the former, the conditioned stimulus onset precedes the onset of the unconditioned stimulus. Okay, so in delay conditioning, it would be the conditioner bottle and the pain, but it remains present while the unconditioned stimulus is present. Okay, so the conditioner bottle would come in, there would be a shock, and then after the shock, the conditioner bottle would leave. There's a temporal gap between the presentation of, or in trace conditioning, there's a temporal gap between the presentation of the conditioned and unconditioned stimulus. The conditioned stimulus must leave a memory trace for the association. Okay, so then for a trace conditioning, you would need a memory trace, so you would need to remember that the conditioner bottle was there. So you need to remember, like if you present the conditioner bottle and then in 10 minutes you shock the mouse would need to remember that the conditioner bottle was there, and then he would associate that to fear, and then that is that's what trace conditioning is. Okay, and then conditioning, interestingly, delay conditioning is independent of the hippocampus, but trace conditioning is not. Okay, so trace conditioning is probably because hippocampus has like a lot of, I don't know. Okay, delay conditioning is independent of hippocampus, but trace conditioning is not, which seems to violate the distinction between declarative and non-declarative memory, which is MTL function. Okay, so that's weird. Delay conditioning doesn't need the hippocampus, but trace conditioning, which is like a short-term memory, seems to need the hippocampus, which is odd. Huh. Okay, experiments where human subjects were conditioned while their attention was diverted watching some movies have shown through trace conditioning is also dependent on the subject's awareness of the relationship between the conditioned and unconditioned stimulus. Therefore, trace conditioning may be thought of as a form of declarative memory. Huh, okay, trace conditioning, declarative memory, then of non-declarative memory. Okay, so trace conditioning is declarative memory. That's the thing to know. Trace conditioning, declarative memory. And also the subject needs to be able to link the conditioner bottle to pain. All right, finally, in operant conditioning, a key distinction can be drawn between goal-based or model-based learning that relates action to outcome in an internal model versus habit-based, model-free. Okay, so habit-based, there is no reward. Goal-based, there is a reward. That's pretty obvious. Learning that acquires and uses cached stimulus response associations. Both types of learning take place in parallel and sometimes compete with each other. Lesion studies in rats have shown habit-based learning to rely on posterior lateral striatum, part of the basal ganglia, sensoriomotor loop. Okay, and so habit-based learning is in basal ganglia. Habit-based learning is in basal ganglia. Maybe that's because basal ganglia helps you walk. Okay, or no, probably because mice use that to move, and they're probably only habits that like moving. Okay, and goal-based learning to rely on hippocampus. That makes sense because it's like goal-related. And the PFC and anterior striatum, part of the basal ganglia. Oh, so goal-based learning also relies on the PFC and part of the basal ganglia. Goal-based learning also relies on the basal ganglia. Interesting. So both types of conditioning rely on the basal ganglia.